Hey everyone, Dr. J. It's the first day of the week, and that means I've got another case of the Mondays.
Uh-oh. Sounds like somebody's got a case of the Mondays.
So today's case highlight's going to be over this gentleman here. His main complaint was he had an uneven front tooth and he just didn't like the smile line when he smiled. So we discussed in detail, not only was the concern the tooth being broken, but his alignment was off, so much so that the teeth had been worn down, the tooth had shifted as a result of the wear, and his front two teeth were not the same length. Many a times when a patient comes in and they think that a veneer can even things out, they don't understand that the gum lines are one of the most important key factors here. So in order to restore this case properly, we used clear aligners and we were able to put the tooth back up into the proper position. That left the gum lines even. That allowed us to restore the links of the teeth to the same links together. Now, one of the hardest things that I get to do in dentistry is actually by doing one veneer try to match another. In some cases, it's just too difficult and we talk about doing two together to make sure we have twins in the front by doing two veneers. In this case, however, the tooth was not so characteristic with all these different variations of, translucency and other things, that we were able to actually do one veneer and match it to his other side. And that's something we do quite often. The ability to actually make veneers here in our practice at the time the patient is here allows us to hand paint, characterize the tooth while they're there in the chair to make sure that we can see the outcome before we put it in the oven and finish making veneers. So it's really nice because it allows us to be very, very, very detailed when it comes to trying to match teeth without sending it off to a lab and hoping it comes back looking like a match. So if that's a case that kind of defines you, if you have one tooth that doesn't match your other from whether injury in the past or discoloration or wear, you name it, we can probably help you too. Give us a shout and we'll go over your case together. In the meantime, y'all have a wonderful week. I pray that you enjoy the rest of it, and I'll see you again next week for another case of the Mondays.